Is I meet mothers or couples that say, no sunshine. I've gone to the hospital. I run tests sometime 3 years ago. They told me I was fine. They did not see anything that was wrong with me. I did that hormone profile. I even did scan. Everything came out well. How about herbal medicine? I'm a beautiful believer in herbal medicine. It's a new year, guys, and for females it means we are 1 year closer to menopause, right? We have to bear children, or menopause will hit from 45. Some persons get it as early as even 40 years now, while other people get as late as 60 years. If you clicked on this video, it probably means you want to get pregnant, and has probably done one or two things to that effect. I want to say that you shouldn't skip this video or fast forward any of its details, because you wouldn't want to miss any of the details I will be sharing. First off, I would advise you go to the hospital and run a fertility test again. I meet mothers or couples that say, no sunshine. I've gone to the hospital. I run tests sometime 3 years ago. They told me I was fine. They did not see anything that was wrong with me. I did that hormone profile. I even did scan. Everything came out well. So gone are those days where you did not know you're supposed to run periodic medical examination, and the thing that came out as negative. Well, what I mean by the thing is the particular medical examination you run. Let's say you run an hormone profile test and all your hormones were in the normal range, and that maybe if you run it 3 months after, that it might come out as you not having normal hormones. Okay, if for example, let's say you actually took run the test for hepatitis or HIV and it came out negative, your next appointment does not really mean that it's going to be negative, right? It could now be positive. My point is that everything came out negative doesn't mean it's going to be negative this time around. I'm not saying it's not going to be negative, but yeah, please run another routine examination, fertility examination test, and if possible, use another hospital and another gynecologist, because sometimes there might be mistakes. I'm not saying there was mistake in your own, but please run another test, run another hormone profile test, do a pap smear, do a urinalysis, check for PID, check for infection, run a pelvic scan for fibroid or whatever. So many things that could show something is wrong in a scan. Yeah, run everything, and yeah, please use another hospital and another gynecologist. The truth is, it's easier to find solutions to a problem when you know what is the problem. For instance, you run an hormone profile test and realize that some of your hormones have problems, right? It's now easy for your doctor or gynecologist to focus on balancing your hormones through lifestyle and some medication. So yes, run all the tests you're supposed to run again. Something as small as internal heat can definitely lead you to infertility. It can make it hard for the sperm to fertilize the egg, and even if there is fertilization, it could predispose you to miscarriage, because when you're pregnant already, you're already hot. Secondly, are you having regular sexual intercourse during your fertile period? Pregnancy don't come like magic, and while some persons might have it easy, just want sex, they are pregnant. You might not have it as easy as others, and that doesn't mean anything is wrong with you or that God doesn't like you. Well, some of you would come to this video and say, I do not have money to buy an ovulation testing kit. How about calculating your cycle and knowing your set period? And even if you can't calculate your cycle, because again, there's also another group of people that have irregular menstruation and their cycle is not regular. Some might not even see menses for 2 months, especially those that have hormone problems. How about monitoring your vaginal secretions? Ovulation secretion is very unique. It's something you cannot miss. And then the moods around your ovulation, like the increased sex urge and every other feeling that comes with ovulation, is very unique. So how about monitoring that period? Again, we have numerous apps that you can download. Some is free, while some you have to purchase, but they are going to help you calculate your ovulation even when you have irregular menstruation, even when you have fertility issues. Having sex once a week will not do. At least 3 to 4 times a week, especially during the middle of your cycle where ovulation is targeted to occur. Anything less than that, well, you're just try your luck. And then again, if you know you're serious about pregnancy or you're having infertility issues, you should be more intentional, more committed. Thirdly, how about herbal medicine? I'm a beautiful believer in herbal medicine. I believe that herbal medicine can be very effective. It has proven to be very effective in Africa even before the advent of modern medicine. So long as you use the right herbs and in the right dosage, I believe it can be effective. By herbal medicine, I mean natural remedies to infertility from plants, trees, herbs, seeds, and green leaves that can be made into teas and soups. Do you know there are natural seeds, spices, and herbs that can be made into soups and teas, all right? That can be used for detox, for internal heat, to even balance hormones, for weight loss journey, and even for antibiotics like to clear infections. I also feel like there should be more research on this because, herbal medicine and modern medicine, which is pharmacological medicine, can actually work hand in hand. If you're a trying to conceive mother and you're a believer, my fourth point is please pray, okay? I know you would say it doesn't concern God, but please pray. God is the giver of children and he does work miracles. He's still in the business of doing miracles. Even till now, he has done miracles in my life over and over again. And I know he can do miracles in your own life. Do not joke about this. Finally, if you've done all this and it's still not working, it's still proving difficult, you should consider other options like IVF, like freezing your eggs if you're a woman, like surrogacy, like adoption. All right, it might be expensive, but if you plan towards it, I'm sure you would get around to do one thing, okay? And then while you're waiting to conceive, you can still do one of this. That way, if your child comes, you could still add it to the adopted or the IVF, whatever options you're choosing.